So it's a complicated question. The reality is that seasonal pollen production clearly impacts patients who have pollen allergies, so that during spring, for those patients who are pollen sensitive, their symptoms are generally worse. But the symptoms may be from their nose, from coughing, from an increase in asthma, from itchy eyes, from swallowing mucus that makes a funny feeling in the back of the throat. So it's been very difficult to sort out whether patients are actually having an increase in esophageal symptoms or if the symptoms from the back of the throat are being interpreted as coming from the esophagus. There's very little hard data to support the notion that esophageal inflammation is really different in a seasonal way, although patients are clearly more affected during their bad time of the year. There are some individuals who we've identified as having more eosinophils in their esophagus, and there are patients like that reported in the medical literature, but they seem to be the minority.
One of the thoughts about why eosinophilic GI diseases may happen is that they're allergic diseases that could be related to environmental exposures. For instance, if a patient develops symptoms in the spring when there are a lot of pollens out, that those pollens may be swallowed, causing an allergic reaction within the intestinal tract, in particular the esophagus. This may participate in some of the pathogenesis of this diseases, primarily on the basis of there can be cross-reactivity sometimes between pollens that are ingested and potential food allergens.